Video begins with a bright, clear, microscopic view of a healthy colon lining. Have you ever wondered what the inside of your gut looks like up close? This is a healthy colon lining, smooth and perfectly intact. It's a remarkable system working silently to keep you healthy. But what happens when this delicate balance is disrupted, even in ways you can't see with the naked eye? Animation zooms into an inflamed colon lining showing immune cells. Sometimes the cause of chronic diarrhea isn't visible during a standard colonoscopy. This is the reality of microscopic colitis. Let's take a closer look. On the left, we have a normal colon. On the right, a colon with microscopic colitis. The inflammation is happening at a cellular level, where the body's own immune cells, like lymphocytes, begin to build up and attack the colon wall. This constant assault leads to persistent watery diarrhea that can severely impact your daily life. Slow-motion view of a biopsy being examined under a microscope. So, how is it diagnosed? The key is a biopsy. A tiny tissue sample from the colon is examined under a microscope. This is where the invisible disease becomes visible. We might see a thickened band of a protein called collagen, a condition known as collagenous colitis. Or we might find a significant increase in white blood cells, called lymphocytes, within the lining, which is known as lymphocytic colitis. Both lead to the same debilitating symptoms: inflammation, damage, and an inability to properly absorb water, resulting in chronic diarrhea. Animation showing risk factors and a patient silhouette in discomfort. This condition can develop over time, often triggered by certain medications, smoking, or an overactive autoimmune response. It leaves you feeling constant discomfort, fatigue, and a frustrating sense of urgency. But understanding the cause is the first step toward finding relief. Animation transitions from inflamed colon to treatment options and a recovering patient. The good news is, microscopic colitis is treatable. Treatment often involves medications to reduce inflammation, along with dietary changes that support gut healing. By addressing the microscopic inflammation, we can restore the colon's normal function. Imagine going from constant discomfort to feeling healthy, energetic, and in control again. This transformation is possible. Microscopic colitis may be an invisible cause of chronic diarrhea, but with the right diagnosis and treatment, a return to wellness is clearly in sight. If you found this information helpful, please give this video a thumbs up and subscribe for more insights into your health. Thanks for watching.